Dr. Celine Latulip, and in this case study, I'll be presenting information about patient portals and proxy accounts. And this video was created as part of the NSERC Create User-Centered Design module. So there are a lot of e-services out there, things like e-banking and e-government services, internet shopping, and patient portals in the US. And these are great for older adults because they don't require mobility. You don't have to get out to a brick and mortar store. In the time of COVID-19, these are certainly safer. In a place like Winnipeg, they are better than navigating icy streets. And for older adults who live in rural areas, these are great because most of the brick and mortar centers would be in urban areas. However, there are some drawbacks, and that is that e-services require good internet access. They require the appropriate devices like a computer or a smartphone. There's a necessity to have an email address that is used for registering and signing up and communications. And then generally you just need a certain level of tech savviness, comfort with technology in order to be able to use these e-services. You also have to be able to remember all the usernames and passwords for every e-service you sign up for. So some older adults may struggle with some of those requirements, and that may mean that they rely on some close others, such as family members or close friends, to help them use e-services, or even in some cases to have those close others use the e-services on their behalf. So in this case study, we're really looking at patient portals, which are very prevalent in the United States. And a patient portal is an e-service that allows you to log in and look at information related to your own health care, such as test results and the prescriptions that might need to be renewed, and scheduling doctor's appointments and looking at visit summaries. So, as I said, these are very prevalent in the US. This is a screenshot of my patient portal from when I lived in North Carolina. And this is a web-based app, although there are mobile apps available too. And you can see that I have to log in here with my username and password. These things have lots of functionality. They were created and really became prevalent because they were sponsored by Obama's Affordable Care Act. And hospitals that don't have a patient portal cannot get reimbursed for Medicare patients. So they became really widespread. You can get into these things. You can view test results, schedule appointments, refill prescriptions, look at your visit summaries, look at your billing summaries, and do all sorts of other things. So the full medical history with that clinic is available online. So you can see things like all the diagnoses that you've had and when they were diagnosed. And it's not just your own information on your patient portal, also your family medical history can be on there. So it's a lot of private information. So as part of a research project that I did with people at Wake Forest Medical Center, we interviewed 10 older adults who have chronic illness. And we asked them about their relationship with their caregivers, how often they use the patient portal, whether the caregiver uses the patient portal with them or on their behalf, and what the risks and benefits of having caregivers use their patient portal were. So what we found was that patients see a lot of benefit in having their caregivers access their patient portals. And 4 out of the 10 patients we interviewed had given their caregivers their patient portal login credentials. None of them had set up what's called a proxy account, where the caregiver would have their own account with their own password and username to get access to the patient's information. Patients had concerns about some of the information. In fact, most of them didn't know that there was that much information on the patient portals because they hadn't spent that much time exploring. And they were concerned about stigmatized illness diagnoses being shared with their caregivers. But they did note, some of them, that they would be okay with that information being shared in the case of an emergency. They had no idea typically that billing and insurance information was on the portal, and they didn't want that information shared unless the caregiver was their spouse. So our takeaways from this were that adult proxy accounts, which could be really useful, might not be used very much because none of the patients in our sample had set up proxy accounts for their caregivers. And we were curious about what percentage of hospitals do actually offer proxy accounts. I called 2 of the health systems in Charlotte, North Carolina, where I lived, to ask them if they had them, and it didn't go well. They didn't have them at the time. So this enabled us to create something like this persona. So this is just a made up story to represent the kind of situation that we saw. So Drew, a 43-year-old radio exec, helps his 71-year-old mother, Nancy, to manage her healthcare by using her patient portal, which he set up. He messages her doctors, renews and picks up her prescriptions, and manages her appointments through the portal. So she might ask him, when's my next appointment? And he just looks it up and lets her know. There's some privacy risks associated with this. So Drew's able to see his mother's full medical history, and that includes some reproductive health choices that she wouldn't actually want him to know about. But there's also not just privacy risks, but security and fraud risks. So Drew can request extra high-dose pain meds that his mother doesn't need or want to feed his own prescription med addiction. And that can happen because from the hospital's viewpoint, it looks like Nancy asking for the high-dose pain meds. They can't tell that it's actually Drew acting on her behalf. Our next study then involved a hospital environmental scan. We called 100 US hospitals, 2 per state, using a secret shopper methodology. And in this case, the interviewer pretended to be a middle-aged woman who was shopping around for a hospital system for her elderly mother. She wanted to help her elderly mother manage her healthcare, and she needed to find a hospital that would have patient portals and proxy accounts so that she could access her mother's portal. What we found in this environmental scan was that 68% of the hospitals offered proxy accounts, but 45% of the hospital staff contacted through this scan endorsed password sharing. In other words, the staff told the interviewer that she should just get her mother to share her portal password with her. And these included hospitals that had proxy accounts. And the other finding was that of the 68% of the hospitals that do offer proxy accounts, only 19% of those offered any way for the patient to limit what information was seen by the proxy or the caregiver. So this was published most recently in the Journal of the American Medical Association, and we'll continue to do work and look at other types of e-services and proxy accounts. So thanks very much to my Wake Forest Medical School colleagues, Drs. David Miller, Tom Arcury, and Sarah Quant. Thanks for watching.